Hi guys, welcome to our ASEAN Student e-Exchange program presentation. My name is Andy and I'll be presenting the section on introduction and background of our presentation. The purpose of this project is to allow ASEAN students to become an e-ambassador for one of the four selected UNSGDs in their partner countries. The four selected UNSGD are number 3, good health and well-being. Number 4, quality education. Number 10, reduce inequality. And last but not least, number 17, partnership for the goals. Our partner country for this program is Thailand. The school we are working with is Chiang Mai Rajabhat University. So what is Chiang Mai Rajabhat University? Chiang Mai Rajabhat University is one of the most prestigious educational institutions in northern Thailand. It offers bachelor, master, and doctoral degree programs in education, humanities, social science, and business management, and so on and so forth. One interesting fact I found out about their university is they actually have heritage sites that displays artifacts that promotes Thailand's culture and history. So here are the students from Singapore side. On the left, you have me, Andy, the group leader. We have Kai Jie, Bernie, Gerard, and Si Jie. For our counterpart, from the left, we have Nan, their group leader, Wine, Nunin, Valerie, and Ari.
It's Gerard, and today I'll be talking about our selected UNSDG background, target, and progress. So first, what are UNSDGs and what is their purpose? To start off, I'd like to share a quote from the UN Secretary General Ban Ki-moon: "Be a global citizen. Act with passion and compassion. Help us make this world safer and more sustainable today and for the generations that will follow us. That is our moral responsibility." So what are UNSDGs? UNSDGs are a blueprint to create a more sustainable future for us all. They are goals created to address the global challenges that we all face. The 17 UNSDGs are listed in the next slide. So these are all the UNSDGs that the UN created. So the selected UNSDG for us is the third, good health and well-being. The goal is to ensure healthy lives and promote well-being for all ages. The targets for this goal are to end AIDS, tuberculosis, malaria, and other tropical diseases, and to combat hepatitis, waterborne, and other communicable diseases by 2030. So what has Thailand made towards this goal? So first up, they have very cheap hospital bills covered under the Universal Health Scheme called UCS. They have volunteer work, and they have cash payments for people affected by COVID-19. So this is the estimated number of people insured under Thailand's health protection scheme as of 2019, according to the World Bank. Thank you.
Good health and well-being, UNSDG number 3. Thailand has been involved in this goal by sponsoring hospital bills for the many to ensure that many have access to healthcare. But in government hospitals, there are long waiting lines for people in Thailand. They also have opportunities for people to engage in volunteer work, community work to check up on the community to ensure that their well-being, their health is fine, ensure that no one slips through the cracks. They also have give out money to people who are affected by COVID-19. Those who often slip through the cracks, they will ensure that they are able to be fed, they're able to fulfill their basic necessities to have a good health and well-being. And to ensure that COVID-19 does not spread throughout Thailand, they also refund travelers, tourists of their accommodation fees to make sure the outbreak doesn't spread throughout the country to contain it. So it has Thailand has done a lot for the health and well-being of their citizens. However, COVID-19 has affected Thailand in overburdening their hospitals as the hospitals are full of people who are suffering from COVID-19. Thus, staff are overburdened with lots of cases, and thus some people might slip through the cracks. It's so bad that they have to sometimes have to share gear in the hospitals, which is not according to protocol. They have to replace them, and some even have suicidal tendencies.
Hi, I'm Bernie Ho, and I'll be sharing the personal experiences that our Thailand counterparts shared with us during the e-Xchange. The topic is the UNSDG goal of good health and well-being. During COVID-19, it has been a hard time for all. We in Singapore have our ways to handle, but what about other countries? These are some projects that our Thailand friends have noticed. There has been cheaper hospital bills when visiting the doctor, an increase in volunteer work for the needy and unprotected, subsidies for people affected by COVID so they can get healthcare, and issuing refunds for the tourists. How has COVID affected the people? Well, our Thailand friends feel that the hospital are overwhelmed and staff have too much on their plate. Resources will need to be shared. Some people may not be able to handle the pressure and have suicidal thoughts. Some of the Thailand students gave us personal experiences and advice for this UNSDG goal. We should be healthy by eating fruits and vegetables, as well as change our poor eating habits of fried fast food. Doing exercises and keeping fit will be nice, as it keeps our immunity system strong. The government should raise awareness of COVID to the public, telling them the do's and don'ts. And lastly, during this time, we can spend more time with our family. Don't forget to wear a mask and queue at checkpoints. This would be the end of my sharing for our Thailand friends' personal experience relating to the matter. Thanks.
My name is Kaise, and I'll be covering on the UNSDG goal of good health and well-being. So, what can we do to help our friends over in Thailand? Well, we can spread awareness on healthcare in Thailand through use of social media. By posting on the social media, more people will know about this and be more aware of the current situation in Thailand. Next, we can tell our friends and family about it and inform them on the healthcare in Thailand. Maybe when you go out with your family and friends, you can mention about it and have it as a conversation. So this way you can have a topic to discuss about, and also ensure that they are aware about the issue of healthcare in Thailand. By doing the above two things mentioned, we hope that we can gain more awareness for this and we can do our part in achieving the UNSDG. Next, I'll move on to the takeaways from this e-Xchange program by the participants. So here are some comments from Thailand's side, and here's from Singapore side. So in conclusion, Thailand is in a similar situation with Singapore, as both countries are coping well with the current COVID-19 situation in terms of taking care of its people and ensuring that the situation is contained by providing cheaper alternatives for those sick and for those who have lost their job to the current situation. However, the medical staffs are taking a toll due to the number of patients they have to treat, being in a situation where demand is greater than supply, and people are being more stressed out due to the minimum human interaction, as well as the constant fear of being infected. But we believe that as long as everyone plays their part in protecting themselves and their loved ones and staying united, we can overcome this obstacle together and achieve the UNSDG goal of good health and well-being. Thank you.